I generally don't like to respond to a colleague after the colleague has left the room because it doesn't seem kosher, but the public is watching this hearing, and I want to just get into this mask issue just briefly. I have had COVID and I've been vaccinated and I wear a mask. I wear a mask to make other people feel safer, even if there weren't variants. I went to my grocery store during senior hour when there aren't a lot of people there, and my grocery clerk, who cannot telecommute, is petrified about getting COVID. She's petrified about getting COVID. And she stands 8 hours a day, a few feet away from people going through the line, and she's petrified. She doesn't want to take COVID home to her child in the small apartment where they live. She doesn't want to take COVID home to her mother, who also lives in that small apartment with her. And maybe 30 million Americans have had COVID. That's the reported cases. So say it's double that. Say it's 60 million. Hundreds of millions of Americans have not had COVID. And they're afraid of getting it because they've seen 500,000 people die. And they've seen a whole lot of people suffer. And they've seen people lose their jobs and lose their income and lose their business. The people in this room who haven't had COVID. It makes people around you feel a little bit safer. It makes my grocery store clerk feel a little bit safer if people she's standing a few feet from every day are wearing a mask. And is that so hard to understand? Is it so hard for us to do? We don't care about these workers? I mean, if she saw me come through with no mask, she would be afraid. And I could say, well, look, I've been vaccinated and I've had COVID. Well, maybe she isn't reading the science about what that means. It's just such a minor thing to do to try to protect the hundreds of millions of Americans who are deathly afraid of getting COVID. That's a reasonable fear, and this is a reasonable step that we can take to try to bring down the fear level that people legitimately have. So I have two issues that I just want to put on the table, and I'd love any of you to address them, and they're kind of long-term issues. There will be a day when a president will say the public health emergency is over. There will continue to be a very long tail of consequences on people's mental health. Seeing death, seeing illness, losing their jobs, losing income, isolation. That will be a long consequence. Many members of the committee have worked together on this already, but we think we have more to do. Second, many Americans who've had COVID will have continuing symptoms. I have these weird neurological symptoms a year later. They're not debilitating, they're not painful, but they're weird and they're 24/7. Many people have symptoms that are more serious: heart impairment, respiratory impairment, impairment of mental functioning, fatigue challenges. How should we as a committee, how should we as a nation, how should the institutions you work for be thinking, planning, investing in these two long-term sets of consequences, mental health and the physical needs of the COVID long symptoms?
Let me address the one that you mentioned about the persistent of post-COVID sequelae, which is a really serious and real issue. It's not imaginary. It varies from person to person. The NIH, with the generosity of the Congress, has invested $1.15 billion in collaboration with the CDC and other agencies in looking at the scope of this real phenomenon, this sequelae, what the ultimate pathogenesis is, because we don't know what the mechanisms are. You mentioned a weird neurological symptom. We're not really quite sure what that is. And we're putting together large cohort studies to be able to find out what the incidence of it is, what the variability, what the range of organ system dysfunctions are, and what the underlying pathogenic mechanisms is. Really very puzzling, Senator, because it's different than if someone is in ICU and has lung damage and you have a pulmonary function abnormalities, or you have a cardiomyopathy and you have a stroke volume that's down. It's different than that. It's people who recover, have the virus no longer there, and have a persistence of things like chronic fatigue, muscle aches, temperature dysregulation, funny kind of neurological issues that they can't explain. That's what we're really focusing on in cohorts of tens of thousands of people. So we are looking at that seriously.
Maybe I'll just chime in on the mental health side and say that we are working, first of all, we need to collect the data. We need to understand in real time what the impacts of this are. We need to work with our state and local health departments to ensure that the resources that they have can be disseminated to their local jurisdictions, that we have toolkits on culturally sensitive prevention strategies for prevention of depression, toolkits for mental health, resources to provide. We need to get those disseminated into the local jurisdictions. And then we are working to do the science and cohort studies, exactly as Dr. Fauci noted, on both the mental health issues as well as on the long haul issues.
Thank you very much. Senator Cassidy.